Heart failure occurs when the heart cannot pump enough blood to meet the body's needs. It is not a disease on its own, but a result of other underlying conditions. Types of heart failure: systolic heart failure, HFrEF. Impairment. The heart struggles to pump blood effectively during systole. Common causes: coronary artery disease. Plaque buildup narrows arteries, reducing blood flow to the heart muscle. Complete blockage can cause heart attacks and scar tissue. Dilated cardiomyopathy. The ventricular walls become thin and weak. Hypertension. Elevated systemic pressure makes it harder for the ventricle to eject blood. The left ventricle must exceed systemic pressure for the aortic valve to open. Valvular heart disease. Damaged valves, such as those affected by stenosis, hinder effective pumping. Ejection. Fraction. Measures contraction effectiveness. Normally, about 60 milliliters out of 100 milliliters is ejected, giving an ejection fraction of 60%. In systolic heart failure, this drops below 40%. Diastolic heart failure, HFpEF. Impairment. The heart has difficulty filling with blood properly during diastole. Common causes: hypertrophic cardiomyopathy. Thickened heart muscle reduces the space available for filling. Restrictive cardiomyopathy. Rigid heart muscle cannot stretch properly. Hypertension can indirectly cause diastolic dysfunction by thickening the heart muscle to cope with higher pressure, reducing filling space. Ejection. Fraction. Often normal, but blood output is reduced due to impaired filling. Left-sided heart failure. Outcome: reduced blood pumping leads to fluid buildup in the lungs, pulmonary edema. Symptoms: shortness of breath, worsening when lying down, and chest crackles due to fluid in the alveoli impeding gas exchange. Right-sided heart failure. Primary cause: often results from left-sided heart failure, which raises pulmonary pressure and makes it harder for the right ventricle to pump blood into the pulmonary artery. Compensation: the right ventricle thickens to pump harder, eventually leading to diastolic dysfunction. Other causes: chronic lung diseases that increase pulmonary blood pressure. Outcome: fluid backs up into the systemic circulation, causing swelling in the feet, sacral area, abdomen, and liver. Fluid status can be assessed by checking the distension of the jugular vein. Management: treating the underlying condition. Focus on addressing the root causes of heart failure. Medications: ACE inhibitors and beta blockers, used to reduce blood pressure in systolic dysfunction. Diuretics help reduce fluid retention. Thank you for watching. If you found this information helpful, please like, comment, share, and subscribe for more health tips.